Good. Okay. So now let's talk about the different types of. We're specifically going to talk about different types of urinary incontinence. It's important to understand and and figure out what type you're dealing with so we can treat it appropriately. All right. So there are two main types of urinary incontinence that we're going to talk about today: stress incontinence and urge incontinence. So stress incontinence is caused by the sudden increase in pressure on the bladder. So that's the leaks that happen with coughing, sneezing, laughing. Urge incontinence is that sudden strong urge or going to the bathroom really frequently. Um, Mixed, you can have both. That's also possible and not uncommon. Less common types that exist, but I did not plan on touching on today. Overflow incontinence is when the bladder does not completely empty. That's something more handled by a medical doctor, which is why I didn't put it in today's presentation. That's usually diagnosed with an ultrasound. So do an ultrasound when the bladder is full, let you empty, and then there should be very little retainage in the bladder after you go to the bathroom. That's caused by things like fibroids, spinal cord injury, MS can cause that. Functional incontinence is when you physically aren't able to get to the bathroom. And I didn't put a ton about that in this presentation because that's more of a mobility issue where you might see a physical therapist for more mobility or strength or gait training issues to help you get to the bathroom safely. So today we're going to talk about stress incontinence and urge incontinence, and then mixed incontinence is both. Stress incontinence. This is often caused by the muscle weakness issues we talked about, so childbirth or any other abdominal injuries or surgeries. Muscle weakness from lack of activity, pressure on the bladder, so that abnormal canister intra-abdominal pressure or constipation put pressure on the bladder. Muscle tightness and rigidity, that inability to relax your muscles. If the pelvic floor muscles are weak, they often won't contract quickly enough to control the flow of urine, or they don't have enough endurance and they relax when they're not supposed to. A pelvic floor that can't relax, so something that's in a chronic state of tension and tightness, is not the same thing as strength. Sometimes people think, if everything's really tight and held together down there, why is that not strength? But a muscle that's in a constant state of contraction is often painful, it's often uncomfortable, and you need full range of motion in muscles for them to truly be strong. So the biceps is a good visual example of this. If you walk around with your elbow constantly in a contracted position and it never fully lengthens, you can't really make any progress on strength in that. If you picked up a weight and just did bicep curls in this little range of motion, that is not the same as moving a muscle through the full range of motion. Pelvic floor muscles are skeletal muscles, just like the bicep. It's no different. They have to be able to move through that full range of motion to be strong. Urge incontinence. Urge incontinence is less of a muscle issue and more of a neuromuscular control issue. So the bladder has nerves that, when it gets full, send signal to the brain. So it's got different stages. The bladder will be half full. It'll send a signal to your brain. Your brain is supposed to process that signal as kind of a mild awareness. It's nothing that should make you running or panicked. It's just sort of an awareness. You suddenly become aware that your bladder is not completely empty. It gets to about 3/4 full and sends a message to the brain. Now you start looking for a bathroom or making a plan for where you're going to find a bathroom, but still not any crazy, sudden, strong urge. If your bladder gets completely full, that urge is strong, your brain sends a signal to the rest of your body, find a bathroom. None of so there's kind of a natural feedback loop that should happen at each stage. You can mess up that loop. And kind of like Pavlov's dogs, where they ring the bell and they start salivating, running water, all of a sudden you have to pee. Or another really common one is people will get home, they'll get out of their car, put the key in the door, oh my God, I gotta go. And that's disrupting that loop. You've retrained your bladder to, instead of sending the graduated signals, to go from no signal to urgent signal. And when your bladder gets that urgent signal, it's going to pee. It's going to relax. That's what it's supposed to do. So if you're getting that all of a sudden urge signal, but your bladder isn't completely full, then that loop is disruptive. So the treatment for that is less about strengthening and more about relearning that control. The bladder has kind of a memory, and it can be trained positively and negatively. So things like holding for as long as possible or ignoring the urge will mess up that loop. Just in case pees are a really common one that completely messes up that loop. So if you get in the habit of, oh, I'm just going to pee because I don't know what the bathroom is going to be like where I'm going, or if you're constantly emptying your bladder before you really get to that urge point, that can mess up the loop. So we encourage people, if you're going somewhere and you know there's going to be a bathroom there, you do not need to pee before you leave the house. Also, don't practice contracting those pelvic floor muscles by stopping the flow of urine. That used to be kind of the go-to. That was how you strengthen those muscles. You'd stop midstream, restart, stop midstream, restart. That completely messes up that messaging loop. So if you've been doing that, stop it. Don't do that. Certain medications too can cause this urge incontinence, or irritants like coffee and alcohol can stimulate your bladder and make you have to go more often. So it's always recommended that you limit those while you're retraining the bladder. And then you can have, like I mentioned, stress, urged, and mixed, all of the above. So let's try a little bit. I've been talking a lot about that coordinated movement between the diaphragm and the pelvic floor. So I'm going to have everybody do a quick breathing assessment, and we'll just make this quick. Put one hand on your belly, one hand on your chest. And then after you're there, take a deep breath in. So you're going to inhale and let it out. Do a couple of them. And I want you to tell me which hand is moving. So if the hand on your stomach is moving, that's a good sign. If it's just up here that's moving, you're breathing backwards. Good enough to keep you alive, but not really controlling that intra-abdominal pressure. Your diaphragm is not fully expanding. If the pelvic floor is really tight, the diaphragm won't fully expand. You'll just take the air in from the upper part of the chest. So a normal breath fills the belly with air. It should fill 360 degrees around the rib cage and the belly, and not just be little shallow breaths from up here in the chest. So there's a good chance that working on fixing the breathing coordination would address a lot of the pelvic floor issues. This is a little harder, but we'll try it. We'll only spend a second on this. Sit on your chair so you're not on those ischiums, not on the bones, but kind of more picture where the muscles would be in that sling. So you get a little tactile feedback from the chair. Now, when you take that deep breath in, you should feel those pelvic floor muscles kind of relax. And it's not a stretch. It's not a strong sensation. It's similar to going from tight muscles here to relax. So it's just kind of a sensation of muscles relaxing. So when you inhale, there should be a little downward relaxation pressure on the pelvic floor. If you don't feel anything, it doesn't necessarily mean it's not happening. It just means your brain is disconnected from those muscles. When you exhale, so let's go the opposite direction now. So we've inhaled, we've relaxed the pelvic floor. When you exhale forcefully, the pelvic floor should zip up. It should immediately tighten. This is how we begin to start to assess it and help you work on strength. So a cough, for example, is a quick forced exhalation. The response should be that pelvic floor tightens immediately. If it doesn't, that can lead to incontinence issues. So we always start with this breathing coordination to kind of figure out where the rhythm might not be working. Are you not relaxing when you inhale, or are you not contracting quickly enough with an exhale? Urge incontinence, the way we figure out what's going on there and different habits is a bladder diary, where for 48 hours, you write down the time and when you peed and how strong the urge was and how much came out. So a strong urge to pee with a small output, that's not normal. That's that mismatched loop. Every 2 to 4 hours during the day is normal. If someone brings me their bladder diary and they're going more than 8 times a day, that's not considered normal, or having to get up multiple times during the night. So that kind of helps us diagnose the urge incontinence. All right, so now we've decided you have one of these things, urge, stress, or all of the above and mixed. What do you do about it? That's probably the most important part. You've probably been waiting for me to get to this point. What do you do about the incontinence? I'm going to speak to you. There are medical interventions, but I'm going to speak to you today about pelvic floor physical therapy because that is my area of knowledge. First thing you would do is come in for an assessment. So on the very first visit, you and your physical therapist would have a lengthy conversation about what's going on. We'd ask you questions about when the symptoms occur. We try and get a handle on medical history and other conditions that might be contributing to the incontinence. I like to know how it's impacting the quality of your life, so we can track goals and make sure we're on the same page. Outcome measures, that's more questions. A bladder diary will be given to you with instructions if that makes sense. We might ask you questions about lifestyle or things like caffeine or alcohol or exercise habits. That would come up too. So we get all the information and connect all the dots. So a lot of times this type of assessment, if you've been to physical therapy before, this is usually a more lengthy conversation and often takes up most of the first visit. There's a lot to cover, and it can be a sensitive topic. Then guess what we do? Breathing. That is the first thing I do in my assessment on day 1. I always start here, and often we don't get past this. Often, this is such a major component in pelvic floor health and things working correctly that if I find someone's breathing out of rhythm or can't feel their pelvic floor contracting and relaxing, this is where we start. And this might be your first 2 weeks of homework, is just to get your breathing rhythm correctly. Is that the microphone? Kevin, what's beeping? Okay, well, carry on. Yeah, all right, everyone's paying attention. I will also assess the hip and low back range of motion. Those hip muscles, the piriformis and the obturator internus that I mentioned, if those are really tight, or especially if you're tight on one side and not the other, That can make the pelvic floor muscles tight too. And then we do an assessment of hip and abdominal strength. So basically all sides of that canister, breathing at the top and the bottom, abdominals in the front, spine muscles in the back. Then, and there's a stop sign on this one because this is helpful, but we do not do this if anyone is uncomfortable. An internal assessment would be the next step. That's where you actually get undressed and we, draping, you're not out in the middle of the clinic like you are for a knee injury by any means. You're in a private room under a blanket, but we actually physically assess the muscles. If you're not sure what's happening with the breathing, you can't feel what's happening down there. You're not really aware if they're relaxing or tightening. This is where we get that information. We can assess the strength of the muscles from this vantage point too. A lot of times people will tell me they're contracting the pelvic floor. They feel like they're doing it, but in reality, they're actually bearing down, kind of like when you're pooping and you're pushing the muscles down. That's not the same. That's overstretching. That's not tightening the muscles. Yes. Yeah, so Kegels specifically refer to tightening the pelvic floor, but they don't involve the breathing component. But yes, essentially, pulling those muscles up and in is what we're looking for when we're assessing strength. So the strength grades, if there's just a little contraction, that's a weak contraction, we should actually feel the muscles pull up and in. And it's the same for men too. You don't have the internal component of pulling up and in, but your organs should go kind of up towards your guts when you're tightening those pelvic floor muscles. Then we come up with a treatment plan. So we've figured out now what type of incontinence you're dealing with. We've figured out areas that are tight or weak. We've figured out some lifestyle habits that might contribute to this, and now we come up with what the plan is. We might give you urge suppression techniques. So I just talked a lot about that, feeling that strong sudden urge and why you shouldn't just give into that, but you can't just pee yourself. So we have some techniques which we'll talk about to suppress that urge. We might give you the bladder diary. We might do what's called down training, which are different techniques to learn how to relax the pelvic floor and get it to go through the full range of motion if you found that it's tight. And then we give you strengthening exercises, which sometimes include Kegels, but often include not just a tightening, but the full breathing and abdominal contraction as well. All right, self-management techniques. This is stuff that you can take out of here today. So if any of this has resonated and you're thinking, I'm pretty sure I have urge incontinence, or I'm pretty sure I have some weakness in the pelvic floor, or I can't feel anything in the pelvic floor, these are some techniques you can start doing today to work on management. Okay, so we talked about urge being a neuromuscular issue. With all issues like this, daily high frequency practice is a must. So this is not the kind of strengthening where you go 3 times a week and do an hour of practice. This works better when you're retraining the brain or retraining coordination. It works better to do small little intervals, but frequently throughout the day. So that breathing practice I showed you, putting one hand here, practicing inhaling and feeling the belly expand. Do that maybe 5 or 6 times in a row. So short, but do it frequently throughout the day, and you will get the hang of it. A couple others. Sit to pee if you're a woman. So hovering above the toilet does not allow those pelvic floor muscles to fully relax. In gross situations, I guess just do the best you can. But whenever possible, make sure you are sitting allowing the muscles to fully relax, and try not to rush. Take your time. Make sure that bladder fully empties. If you don't completely empty the bladder, if you're in a rush, you're messing with that neurological loop like we talked about. Try not to hold it. Pay attention. You can do your own. There's nothing special about the bladder diary. It's just a list with times and spaces to write things in. Keep track. Pay attention to how often you're going to the bathroom. If you're holding it for more than 4 to 5 hours, try not to. But on the same token, skip those just in case pees. That really trains your bladder to empty before it's truly full. Limit irritants. Caffeine and alcohol can make it worse if you're finding that urge incontinence is your issue. And don't panic. Try some urge suppression techniques instead of running to the bathroom. Urge suppression techniques are on the next slide. Oh, those are all labeled number 1. On mine, it's 1 through 5. They're all equally as important. That's why. Okay. So you feel that strong, sudden urge, and I just told you not to run to the bathroom. There it is. That's the one. Okay. You can sit down to quiet the urge. So if you stand up and all of a sudden you have to pee really strong urge, sit back down, take a couple deep breaths, get back up again. Do 10 heel raises. Why does that work? There's actually biological evidence for the pee-pee dance. So this, where you're crossing the legs and jumping up and down. The motor cortex in the brain, the motor neurons that control the muscles in the feet and ankles are right next to the motor neurons that control the bladder and pelvic floor muscles. So when you stimulate those feet and ankle muscles, that helps stimulate the muscles around the bladder to contract and not let go. So there's actual biology behind the pee-pee dance. You can do 5 quick pelvic floor contractions. So regain control. Once you learn how to properly contract those muscles, doing just a couple of quick contractions can calm the urge. Perform a couple of deep breaths. Try and calm the bladder. Get rid of that strong feedback loop. And remember, this urge, if your bladder is not full, you don't actually have to go to the bathroom. We're trying to calm that urge. And then walk slowly. Don't run. Don't feed into that fight or flight mode. If stress incontinence is more the issue, you can practice tightening the pelvic floor and abdominals during everyday activity. So once you learn how to do those strengthening techniques, we teach them to you in physical therapy, just practice them throughout the day. This is not the kind of strengthening that you need a dedicated time for. Try and tighten your pelvic floor muscles before you cough, laugh, or sneeze. So you don't always get a ton of warning. Sometimes it comes out of nowhere. But if you're like me and you never sneeze just once, it's always 3 or 4 times in a row. See if once you learn how to tighten those pelvic floor muscles, try and consciously contract them before that happens. Avoid holding your breath while lifting. Holding your breath creates more of that intra-abdominal pressure I've been talking about. More pressure means more pressure on the bladder and can cause leaks. And then practice pelvic floor contractions while breathing. So you practice being able to hold that muscle contraction to work on endurance for that muscle. All of these work a lot better when you've been trained how to do it correctly. So often, pelvic floor physical therapy, I had this question earlier, how often do I have to come to therapy? And a lot of times we go through these phases. You come in, we teach you how to do the breathing correctly, you go home and practice that for a couple weeks. Once you get the breathing part correctly, now we can move on to getting the pelvic floor muscles to contract correctly. And then you practice that for a couple weeks. So it's not as often. It's not usually a 2 to 3 time a week protocol like some other physical therapy experience you might have been to. Yes?
How do you, for guys,
yes.
How do you control
So that's usually because the muscles won't fully relax. So that's sometimes it's physical pressure from like the prostate or something pushing, but a lot of times it's the muscles not fully relaxing. So learning how to get those muscles from here to relax would be the first place I'd start. But we dive into a full medical history to find out what may be the cause of that, which we won't do here. I won't ask you. Takeaway. There's treatment for all of this. There's pretty effective treatment. Um, and I really encourage you not to let embarrassment or just not wanting to talk about it. I'm actually very impressed with the turnout today, but don't let that keep you from seeking, improvements in quality of life. This is again common, but not normal, and much can be done about it. If I'm happy to answer questions, but if you would prefer to ask me a question in private, you can email me. I'd be happy to field questions without making you raise your hand in a crowded room. Yeah.
A good goal to strive for on pelvic floor exercises. How many times a day?
Yeah. So once you're like the strengthening one.
Yeah.
Yep. So he asked what's a good goal or kind of a protocol for doing the strengthening exercises, how many times a day. So once you're sure that you can correctly contract those muscles, I have people start with 10 times, and you do it as many on the hour as much as you can. If you forget an hour here or there, that's okay. So maybe 6 times a day, 10 contractions. You don't need to practice it for 20 minutes at a time. That would take you just a minute to do. And then I have you do your aim for a 10-second hold where you can contract those muscles and hold them for a full 10 seconds without them letting go. So first we practice just squeezing the muscles, then we practice holding for 10 seconds. So that's where I would start. And David, did you have a question?
Yeah. Diuretics. After I take that.
He's asking about diuretics.
Yeah, I can't.
Yeah.
Very far away from that.
Nope. That is flooding the diuretics are flooding your system. They're getting the fluid out of your lymphatic and venous system, pushing it to the kidneys. The kidneys are doing their job and sending it to the bladder to empty. That's kind of a outside of physical therapy control. I mean, you can still use some of those urge suppression techniques so you're not, you have a little more time to get from urge to the bathroom, but the frequency, you're not going to have a normal frequency of going to the bathroom when you're on a diuretic. That disrupts that for sure. But some of those urge suppression techniques should help with, having to run to get there. Helen. Oh, I love this question. So she asked, can you blame the amount of water you drink on how many times you go to the bathroom? I am so glad you brought this up because we hear all the time from people, I don't want to drink water because it makes me have to pee. But you are supposed to pee. This whole thing is not about stopping peeing. It's just getting control of it. And this is another bladder retraining thing. If you go from not drinking a lot of water to really trying to pay attention to hydration and drinking a lot of water during the day, initially you're going to have to pee more often, but your body will get used to that and things will normalize. So don't skip the water. Glad you asked that. And that's super important for constipation management too. So by dehydrating yourself to try not to pee less, you may be creating a constipation issue, which will then cause a bladder incontinence issue. So just don't do it. You know what? That's all over the map. It really is. And I don't know what I don't think that 8 ounces or for body weight thing is actually accurate. If you feel thirsty, you're dehydrated. So I would suggest just having water and kind of sipping on it all day. Yeah. Yes. Okay. I mean, that's from a urologist. So Joe said her urologist told her to drink 2.5 times her weight in water. Ounces. Ounces. Yeah.
If you weighed 100, it'd be 200 ounces.
200 ounces. Yeah. That sounds like a lot to me. Wait. Now she's taking it back. Joe's retracting her statement. Hold on.
If you're 160 pounds,
Yes.
divided by 2.5.
Oh, that's way more manageable. I don't know. If you feel thirsty, you are dehydrated. So, correct. Yes. The what? I'm not familiar with Vesicare. Is that a bladder suppressant? Is that a medication to calm the urge? Okay. I'm not super familiar with the medications. That's sort of a doctor, not a PT question, but it would help. I would always try a more conservative management first, but if there are things like diuretics that are disrupting that loop and things outside of your actual control, then I would imagine those medications are pretty helpful and needed. Yeah. 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 If sometimes I talked a lot today about the physical therapy aspects and the muscle control and urge and things that you can manage, but there are many other health conditions that you would need a medication to help with. That's kind of out of my area. Yes.
The average number of times you get up in the night and go to sleep.
Should be 0.
0?
Yeah. You should be able to sleep through it. Now, there are a multitude of conditions that are out of control, but when you are asleep for 6 to 8 hours, your body should be able to manage that. I would say, if you're once a night, that's pretty normal, but more than that, I would start complaining. Yeah.
Is there any wisdom in cutting down the intake of liquid before you go to bed?
Before you go to bed, yes. So cutting down, I talked about the importance of staying hydrated, but you can time it. So, before you exercise, I wouldn't drink a giant jug of water and then exercise on a full bladder if I had issues with stress incontinence. And same thing, you don't need to fill your bladder up before you go to bed. Yeah, so hydration is important, but you could certainly time it. And then avoiding things like alcohol or other stimulants too, if you're finding that you're waking, or depressants, if you're finding that you're waking up a lot during the night. Yep, correct.
What did she say?
She said that citrus fruits are another irritant on the bladder. Oh, and carbonation. I forgot about that one. Yeah, citrus fruits and carbonation can be irritants. Yeah, it's valuable. Carbonated citrus, that's the worst. It's valuable on that bladder diary too, to note what you're drinking during the day. That's sometimes we ask for that information too. So on the bladder diary, not just how often you're going and what the urge is, but what liquid you're putting in your body. That can help give you a sense of, oh yeah, my symptoms are worse when I drink a ton of coffee. Yeah.
On that note, in our experience, we learned from the urologist that lemon juice and some citrusy things can combat infections.
Okay.
UTI is
Oh,
something
okay.
that hits Parkinson's
Yes.
people and hits them hard because the cognitive
Mhm.
effect of the UTI. And the other thing is that that's all I'll say.
She's saying that the urologist said that the citrus has a protective effect in avoiding UTIs, but maybe an irritant. And not everybody's sensitive to the same things. So, you could certainly, if you were trying the lemon juice to avoid the UTIs, yeah, maybe that's not enough to be an irritant. I have not heard that before, but
we learned after uncomfortable. But is that if it's too concentrated because you're not voiding enough,
Yeah.
or you're not drinking enough water, that concentration is harder on the bladder and could kind of set you up for UTI.
Yes, that's
these
so.
are lessons in UTI land.
Yeah, no, that's another good point. So not emptying your bladder frequently enough or being dehydrated when your urine output is darker in color can be an irritant
And that
too
can
and
lead
set
to
you up for
UTI.
UTIs.
And then UTI leads to confusion,
Yeah.
which leads to
Or further
inability
infections.
to, get up the stairs to bed,
Yeah.
and could lead to an impression in the emergency room because you're confused that you're worse off than you really are.
Yeah.
But UTIs and older people, particularly with Parkinson's, we all get confused about what day it is in an emergency room.
Yeah.
But if you can't answer what day and you're in this emergency room, you're kind of categorized.
Yeah,
as one
no, I know.
level
Often
of ability
she's
versus
talking about how UTIs can often present as confusion in people with Parkinson's, and it's not always the urinary symptoms first. So
Yeah, and so I learned, because we had to stay there from the urologist office, is that often if a UTI, if there's confusion, if your urology practice will do this, call and say, we need a sample test. Because they'll see it and then they'll know and they'll nip it.
It's not
in the
your
bud
baseline.
before you end up in the emergency
Yeah.
room.
is there help? Yeah. Yes.
No one hears it.
I hope not. She asked if chocolate before bedtime affects caffeine. How much chocolate are we talking about? Bob, fess up. Yeah, everybody's has different tolerances too. I cannot have any coffee in the afternoon or I would be a mess, but I know people that have no issue with that. So yeah, I guess maybe. What do you want me to tell him? Tell me what you want me to tell him and I'll. It's a big problem, Bob. Bob, listen to your wife. Moderation. There we go. That's yeah. Sandy.
I found out last year that a bladder control medication that my husband had been on, which is trospium chloride, interacted with carbidopa levodopa.
Oh, interesting. Did everyone hear that? One of the there's a
Trospium chloride.
bladder control medication that interferes with carbidopa levodopa.
My husband's occurrences of falls have gone from 68 in the year 2024 down to 38 this past year. So what I'm saying to you is the interaction between trospium chloride, bladder control med, and carbidopa levodopa has eliminating that med, and he's on a different one now, has greatly improved his number of falls.
So make sure your doctor knows all the medications you're on. And well, it's 12:30 and Kevin's walking towards me, so I think I'm getting the hook.
We have time for one or two more questions, and then we have to wrap it up.
Yvonne.
How can you?
Yeah. Yeah. Oh, fantastic. Yvonne's not asking a question. She's giving a testimonial. I talked about curling your toes or bouncing up and down the pee-pee dance, and it's working. So, uh-oh. We'll ignore it. It'll go away again. Yes, there really is a biological reason why the toe curling helps suppress a strong urge. And when you start practicing suppressing that urge, your body won't react so quickly. So that's, something you have to practice over time.
One more question?
Yeah.
Well, I didn't pay her to say that. However, yes, please do. Please consider going to that event. You will really be impressed and you will really enjoy the show. I want to thank Lindsay for being
You're
here
welcome.
today.
Thanks for having me. Appreciate it.
Excellent presentation. And you are now on our annual
Great.
speakers cycle. Are we funded? Good. Donations. Thank you all for coming.
Thank you. Oh, thank you. Thanks for coming.
That was really awesome.
Thank you for being here.
Can I become a patient of yours?
Absolutely.
Good. I've had some serious bouts going on for quite a while now.
Yeah.